This video is all about AEDs. AED stands for Automatic External Defibrillator, often called defibrillators or defibs. They are safe and simple to use. An AED is an important link in the chain of survival. The chain of survival has 4 links and when combined increases the chance of survival of the patient. Calling 999 early, starting CPR early, getting an AED applied early and then getting them off to further care dramatically increases their chance of survival. If someone is unconscious and not breathing, then we need to start CPR and apply an AED. An AED does not restart the heart. It uses an electrical shock to stop the heart so that it has a chance to reset itself back to a normal rhythm. For example, when someone has a heart attack, the heart can go into a quiver called ventricular fibrillation for about 10 minutes afterwards. While quivering, the heart does not pump blood around the body, so the AED stops the heart to allow it to reset and start pumping again. If we can get an AED to shock the heart within that 10-minute window, then the patient's chance of survival is dramatically increased. A little bit like when our laptop freezes. We don't get a screwdriver out and fix it. What do? We simply turn it on and off again and let it restart itself. This is very similar to how an AED works. The heart is beating normally, and then when somebody has a heart attack, the heart goes into that quiver I mentioned earlier. The AED shocks the heart to stop it dead so that it has a chance to restart back at a normal rhythm. We do not have to assess what is going on inside the body. All we have to do is apply the AED if someone is not breathing, and the AED will make the decisions for us. It will not shock anybody with a healthy heartbeat. It will not shock anyone who has been dead for some time. It will only shock them if they need it. No decisions for us to make. Simply apply the AED if they are not breathing and follow the instructions. Inside an AED, you will find 5 items. Scissors to remove clothes. The patient needs to be topless, including the bra. Gloves to wear. A CPR face mask so you can perform the breaths if appropriate. A small towel or wipe to remove any sweat so that the pads stick well. And a razor to remove any hair. You don't have to shave most people, just the really hairy ones. You may also find spare adult pads or pediatric pads inside. Here is how to use one. Switch the AED on via a button or by opening the lid. Remove any clothing from the chest using the scissors. Place the pads onto the patient's chest. There will be pictures on the pad which will show where the pads are to be placed. Listen to the instructions. The device will analyse the heart rhythm and you will have to pause compressions. It will then decide if the patient needs a shock. If the patient does not need a shock, continue with CPR. If they do need a shock, then press the button when instructed. The device will reanalyse the heart rhythm every 2 minutes and you may need to shock the patient multiple times. Here are some safety points. Only use on humans. If the patient is on oxygen, push it at least 1 metre away before pressing the shock button. Be cautious of metal floors or water. A bit of rain is fine, but you may need to drag them out of large puddles or streams. Remove any large pieces of jewellery that touch the pads. Do not use on a baby under 1 year old, and do not touch the patient when you press the shock button. You do not have to be qualified to use an AED. Anyone can use them, but training increases confidence and chance of success. The quicker you get access to an AED, the higher chance of survival of it working. If the AED is located in a locked box, call 999 and they will tell you the code to gain access. So to recap, an AED is to be used when somebody is not breathing normally. Switch on the device and follow the instructions. Thank you for listening. I hope you found this helpful.